And we're off to the Health Hub Times Square in Ballincollig, where Anneliese Dressel joins me. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And I know you have a bit of a barking cough, so we're keeping our fingers crossed we'll be able to get through this slot. Let's get straight into questions. Helena has been on. Question for Anneliese, please. And I hope I'm pronouncing this right. Taurine supplement, is it good to take, please? And what are the benefits? Taurine.
Yeah, so taurine is an amino acid, which means it's a protein, and we normally would get it from the animal foods in our diet. It does also actually come in vegetarian proteins as well, but it would be very much strong in the meats, and particularly the organ meats. And taurine is a very good one to take for mood and increased concentration and focus. It's a precursor to one of those kind of neurotransmitters that help us feel motivated and calm. It's often recommended for kids with ADHD as well, to help them focus and concentrate more. So I think that would probably be the main reason that people would take it, Patricia, on its own. Otherwise, it's actually better to take it as a mix of different amino acids. There's a lot of people would take amino acids for muscle building, and I think it's better to take them as a blend then, so you can make sure that you're getting absolutely everything. But it is a good one for mood, mostly used for that.
Okay, let's stay with issues with muscle and pain. Could Anneliese please talk about Revive Joint Complex? Is it any good? I've been taking it. Now, the texture doesn't say for how long, but I'm not seeing any benefits. I suffer with shoulder, neck and body pains. Am I on the right thing?
Well, I would say that if you're taking it for at least 2 to 3 months and it hasn't made any difference, it's definitely not doing the right thing. Now, it's a very good product. It's a kind of a combination of things for the bones with vitamin D and K, and the joints, collagen and glucosamine, and there's a few other really nice bits in there as well. And we do get good feedback on it for customers, but in this case, obviously, it's not hitting the spot. So the question is where is that pain coming from? So they're saying shoulder and neck and back pain. So I think maybe is it even muscular? Is it possible that you've pulled something? Is it a tendon? Maybe it is joint pain, all right, for sure, but maybe there is muscle stuff going on as well. So it's always horses for courses, Patricia. So the joint is definitely good for people who want to maintain their joint and bones. But I find a lot of people who've got pain, it's muscular, in which case you're looking at things really like magnesium is wonderful for muscle, and anything that kind of helps with the damaged muscle or damaged tendons, like Rutagrava is a great one now if you pulled a tendon, say, in your neck, or if you pulled something. Rux Tox is very good. HUSTOX, very good for pulled muscles. Arnica, very good for pulled muscles. So you could try something like that. The other thing I would recommend as well is possibly try an anti-inflammatory first, because your joints are not going to be able to repair themselves if there's a lot of inflammation happening. So you're looking there at turmeric and boswellia being the most effective natural anti-inflammatories. So you could try a supplement like Nutri-Advanced has one called Curcudine Forte. If you can't get that, I know the Solgar 7 has a similar blend of stuff, probably not as strong. But that can be an alternative if you can't get your hands on the Nutri-Advanced. We also get very good feedback on 2 particular joint support ones. One is by a company called One Nutrition, and it's literally called Joint Support. And the other one is GAL UC2 cartilage. It's a very, very specific type of cartilage for joint support, and we get great feedback on that one as well.
Okay, hi Anneliese. I woke up, I would say it was about 2 weeks ago, with a darting pain in my hip and bottom area. It sometimes darts down my thigh. It's okay when I'm walking and I'm applying different gels which help a little bit. I'm wondering, could it be sciatica? And if so, what would you suggest for same?
Yeah, it could be sciatica. I suppose the best thing to do is maybe book in with a physio or a doctor and see what they would say. But a sciatica typically would have that type of sharp darting pain, and very, very commonly referred by pain down one of the legs. And unfortunately, what the thing is with sciatica is that the sciatic nerve has become inflamed, or possibly even trapped between collapsing vertebrae and discs, and there's pressure being put on it. So I think really you need to go down the full medical route for this, and there is an injection that you can get. It's actually into the piriformis muscle of the buttock. So there's a big muscle in your buttock called the piriformis. And if you get an injection into that, you can get amazing relief for sciatica. and it would last at least 6 months. If you wanted to go the natural route, you're probably looking at taking natural anti-inflammatories, but I think that's like a butterfly's brush compared to the actual injection, Patricia. So that's the route I'd be going, and that's what I'd recommend for that.
Okay, Anne in Mallow says, hi Anneliese, love your slot every Monday. My problem is dry eyes. I'm in my 70s and I'm weary from putting sprays and drops into my eyes continuously, as my eyes seem to be constantly dry. Is there anything else I should be doing? Many thanks in anticipation, says Anne in Mallow. Dry eyes.
Yeah, so it's actually quite common, Patricia, and very much so, I think, as well, with women after menopause. I think everything dries up, including eyes. So I always would recommend that you put the fat in from the inside out, first and foremostly. And I would definitely take a combination of different types of oils, like, for example, the omega-7 from sea buckthorn are particularly good for mucous membrane health. So the mucous membranes in your eyes are the ones that will produce the tears and keep it moist. And then you could also take an omega-3 fat. Of course, the lovely advantage of the omega-3 fish oils is that they do so many other jobs as well. They keep your blood lovely and thin, so they can help blood pressure, heart health. They keep your good cholesterol up. They are fantastic in terms of making your cells sensitive to insulin, so they prevent type 2 diabetes. And of course, they're brain protective, so they help protect against cognitive decline in older age. So you're getting a good bang for your buck with the omega-3 fats, and add an omega-7 as well. There is a herb called eyebright, and for some people that can work well, but for some people it just doesn't. It's a bit hit and miss, Patricia. So if you're getting eyebright, it's good to maybe get it mixed in as well with other things that are good for the health of the eye, like lutein and lycopene. And these are the pigments that keep the cells in our eyes very healthy. And again, specifically the lutein for macular degeneration is very good. And I think if you've got dry eye, you may or may not be at increased risk of macular degeneration, but definitely nourishing the whole eye as opposed to just trying to keep it hydrated with a spray is the way to go. So give that a go. And then the last thing I would suggest is very simple, which is at night time, go to bed with 2 chamomile tea bags that have been soaked and let kind of absorb a lot of boiling water, and just put them over your eyes and let them sit on your eyes for at least 20 minutes. And it's very, very, very soothing at night time for dry eye.
Okay, well done. And it must be really annoying to have dry eyes. Okay, hi Anneliese. What's the best natural remedy for somebody suffering from anxiety and teeth grinding?
Okay, so there are lots of things that can help with anxiety naturally. And teeth grinding would be typically, like a lot of people would have it, whether or not they're anxious at night. And the best thing for that actually is just to use the mouth guard to protect the teeth. But a couple of things that could help for sure, especially going to sleep at night. The first thing I'd recommend, I think probably there, is the valerian, because valerian actually is a typical one used for sleep and relaxation. It just brings down all the stress hormones in the body, but it actually does have some muscle relaxing benefits as well. So that could be very good for the muscles in the jaw. And you could get that on its own as a tincture and take it before sleep, or you can get it as part of a kind of sleep remedy. Like, it's definitely part of the one that we feel works the best for our customers, which is the NHP Advanced Sleep Support. And that has other things in there that can help with anxiety, like hops and passiflora and lemon balm and chamomile. So all of these things help with stress and anxiety. They really, basically, all they do is kind of manage the stress hormones. So they work in the day to keep you feeling less anxious, but they work at night to stop the busy body, busy brain. And then 2 things I'd recommend then in the day in terms of long-term support. The first one is something called ashwagandha, which is a great herb for any type of anxiety, whether it's stress-related, whether it's low mood related, whether it's exam related, whether it's temporary, whether it's long term. It can work really, really well just to improve your ability to cope. So you can basically take on a lot more without feeling anxious. And that's a good one for long term, but it takes a while to kick in. And then you should definitely add to that something that works in the short term. So what you're looking there at is L-theanine. Lemon balm is a great one, and Viridian do a lovely supplement that has both of those in it. Macanta do a supplement with L-theanine and L-ornithine and some of the B vitamins in there, and that's another lovely one to take during the day. And then we also get great feedback on one which is called Resilience, and it exactly does that. It just improves your resilience, and that's by a company called Nutri Advanced. So you could try a combo of those and see can you minimise anxiety during the day as well.
Okay, well done. You got through the slot without coughing. I'm impressed. We'll talk next week, Anneliese. Thank you for that. Anneliese Giselle, Health Hub, Times Square in Ballincollig. Her website is healthhubstore.com and she'll put up as heard on the radio later on today.